Come on. Cervical fractures, viscerating ribs, and of course, your favorite fighter, Devora. Today, we are reacting to the X-ray moves and injuries from... Are their super moves medically accurate? We're about to find out. Let's dive right in. Oh, you get people who get jaw dislocations from opening their jaw too quickly or too wide at the jaw joint here. It's like a hook. And so it hooks in. So sometimes when you open too much, it drops down and then goes posterior and it gets stuck. We need to put it back in. But it's pretty difficult because you're having all these muscles spasming and preventing it from actually relaxing and allowing it to get back in the joint. Come on. Come on. What I like about this is the fact that we have lungs underneath. So if you do have a rib fracture, you always worry about hemothorax, you worry about pneumothorax, you worry about a combination of a hemo-pneumothorax. Pneumothorax is when you have a collapsed lung and there's air that's forming inside the chest cavity that's compressing down on the lung itself. The hemothorax, which basically is blood getting in that space. Oh, crushing the ribs. Obviously, we worry about the heart that's sitting right there. This is the MEDIASTINUM, which houses basically the aorta that's coming out, the heart, your esophagus, and the tree branches of your airway. Anybody can look down at their chest, and maybe just below the nipple, you're actually seeing a PMI, basically the point of maximal impulse. You can actually see it kind of bobbing and moving. Oh, whoa. So you're actually snapping all the ligaments.
Do you think I've damaged the ligaments?
I don't care.
You have these very long ligaments all protected. Your spinous process ligaments, you have interspinous ligaments, a lot of different ligaments that are holding everything together. Very vital structure, and that's why we have all this protection. And so when you have injuries, slip disc, it's because there's nowhere for anything to go and it just slips into the path of least resistance. What? We got a gun? We got a bullet that goes left lower quadrant, probably shatters part of the pelvis. The pelvis can bleed a lot and it's like a storage area. So sometimes we can do a binder to the pelvis, typically if it's an open pelvis, and kind of close it down to try to lock down any bleeding. A lot of times there's always controversy about bullets bouncing here and there and everywhere, just like the gummy bears. If it's not fast enough and powerful enough to just blast through everything and just go straight through, it could actually change directions. Oh, I remember the facial injury like that when Apollo Creed died in Rocky IV. Could the bone have gone into his brain and killed him? I've never seen it in real life. Hypothetically, sure, if you have enough force and you cause enough brain trauma with that force, could the bones go backwards into the brain? Yeah, potentially. Oh, whoa. Holy karate chop to the neck. I'm just thinking about my hand, how that would basically snap the metacarpal in half. Having a hyperextension injury like that, a lot of times what you're seeing on an x-ray, the vertebral body will actually bend back and actually can cause a chip fracture. And then the concern with that is that chip fracture going in the column where the spinal cord is, and now you have a free bone floating around. I see a lot of rib fractures from people falling, and then we're doing CPR on somebody in the emergency department. We're causing a lot of rib fractures as well, because the only way to compress the heart is to get deep enough, and the only way to get deep enough is to fracture ribs. Now, typically if you're younger, like say an adolescent or a child, the ribs are actually more cartilaginous. Basically they're softer, so you can actually bend them without having to actually break the ribs. What the? Whoa. What? Oh! Obviously, the bones just don't give away super easy, but they can puncture through the skin. They can pop through. We call them open fractures. And if that's the case, if somebody has an open fracture, laceration, blood coming through where the fracture is, even if the bone's not sticking out, there's a concern that there could be an infection of the bone, which then can later lead to osteomyelitis. Oh, burned up. Whoa, 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 whoa. Popping right through the neck. So you have major blood vessels on each side. You have your carotid arteries and your jugular veins, and then you have your nerves running up that way as well. Middle, you have your trachea, you have your esophagus that's decompressed in there, but it is there. The trachea is made up of rings that go all the way around, but they don't completely go all the way around except for one, which is your cricoid. What? enucleating the eye by the amount of pressure and force. Gotta be super painful. If there's leaking eye fluid, we'll actually put some fluorescein, which is basically a dye, to the eye and see if it's leaking out. If we see a stream, it's called the Seidel's sign. The goop is coming out, the fluid of your eye. And if that occurs, you're like, don't touch the eye, cover it, call the ophthalmologist. They need to get in there and fix this right away. We got a lot of rib fractures. All of a sudden we get these Wolverine type claws causing facial trauma, a lot of blood flying out of there. Obviously blood's not supposed to squirt like that on the face. You can get like one maybe splash. A lot of times paramedics will put bandages on right away. We take them off.
Gotta rip that band-aid off now.
And then all of a sudden just like shoots across the room. But it's a stream. It's not just like this smorgasbord of everything. Oh. Wow, I see the frontalis muscle, I see the temporalis muscle.
I see London, I see France.
When somebody actually gets lacerated in these areas, we actually have to make sure they're attached, because if you have your frontalis muscle shredded up and you don't attach it well, you won't be able to basically like lift your eyebrows well. And in certain situations, you want to be able to move your face. Whoa, holy cow, that is like equivalent to the mountain. Sometimes when you pull on the head, you'll actually cause pain relief if somebody's having radiculopathy, basically a compression of the nerves in the neck going out to your extremities. But obviously if you pull too hard and rotate, you're going to cause fractures and dislocations. We don't actually see that where the body separates like that, but we see compressive forces down. If somebody jumps from a high building and they land on their feet, you get a compressive force all the way through the body and it can explode and fracture. Whoa, whoa, definitely flailed segment. Flailed segment of the ribs where they fracture in multiple places on one or two ribs and the whole section is separate basically. And a lot of times we'll be able to see this as somebody breathes in, you're expanding your chest, that area sucks in, and when you breathe out, when everything kind of relaxes, it goes opposite. Oh man, that was cool. Cool mechanism. Let me smash somebody's head with other skulls. Typically, fractures don't just explode like that when it comes to the skull. They just basically crack open. Obviously, there are exceptions to the rule when a lot of force is occurring.
The force is strong in this one.
Car accidents or when people fall from great heights and their brains smatter out, then skulls come into pieces. On your everyday injuries, typically it's just a one-line type fracture. If you guys like this, check out this playlist right here. And as always, please make sure you subscribe, turn those bell notifications on, hit that like button. Thank you so much for watching, and stay healthy, my friends.